are pleased to welcome Phil Scalo, who is President and CEO of Bartley Healthcare. Phil, what is Bartley Healthcare?
Bartley Healthcare is a post-acute provider. We provide services, assisted living, rehabilitation, skilled nursing, memory care, and some home care services.
It's interesting. We met you through our friends at Felician University. We had a whole discussion with Dr. Prisco up there, the president, talking about gerontology, because they have the Institute for Gerontology up there. And this whole area exploded for us. I mean, we knew there was an issue. We knew that the older or elder population was growing. But tell folks how huge this issue is and what the need is.
Well, what happens right now is most people think that when they get older, they'll just be taken care of, or they can be taken care of at home. And with the age wave that's hitting, we're going to see it even more. But what happens most of the time is that people are underserved. They don't know what benefits are available to them. They don't know what services are available to them. And many times the services that are available are just not available in such a way that they can avail themselves to them.
So let's break this down a little bit. And by the way, at your place, what kind of services are we talking about?
Well, we have a campus in Jackson where we provide really the services. It's a continuum from assisted living, which people live in apartments, have a lot of activities, and we help them with certain activities of daily living. And our continuum goes all the way to people who are end stage, on hospice. In between, we have the rehab. We have a big memory care component for people with Alzheimer's and related dementia. So we're taking care of the people who cannot be taken care of at home or cannot be safe at home.
How'd you get into this?
It's an interesting story, actually. I'm an attorney by training, and I practiced law for many years.
Well, how does this come into your world?
You know, it's kind of interesting you say that. I work with Rutgers sometimes, and I go to some student things where you talk about mentoring, and I tell them about the lawyer part, and I tell them about the nursing home and the skilled nursing part, and they get surprised like you were.
Right.
But I had some expertise in financing, EDA financing at the time.
Economic Development Authority.
Authority, that's right. And I have some friends who were physicians in the Jackson area who wanted to start a nursing home that was at a higher quality than what they were seeing. So we built a little nursing home back in 1985, a 120-bed nursing home. And over time, I became managing partner, became more involved. And I guess about 15 years ago, as the company grew, I became the CEO. And it's kind of interesting, you know, it's one of those things where as a lawyer, you can make a difference in some ways, but in our business, every day you can make a difference for somebody, and it's a very rewarding business. Not the most exciting business, but very rewarding.
I mean, describe the kinds of rewards and the kinds of challenges. Do the rewards first.
Well, the rewards, you know, for staff and for us is that we're taking care of people that no one else can take care of. We become their family. You know, a lot of people talk about placing or putting someone in a nursing home or assisted living. We refer to it as moving in because it's their home. So we're serving them in their home. And in many cases, we are their family.
That's not too strong a word, Phil?
No, that's not too strong a word.
You're literally becoming their family.
We become their family because many people don't.
Actually, showing a video as you're talking. Go ahead.
Yeah, many people don't have a lot of family. And then you know, every day there's somebody there for them. And it's always very interesting to see the relationship, especially between nurses and nurses' aides and the residents. They are the family. And even the kind of thing where when someone passes, and that's what happens, you know, in the end of life thing, we're faced with that. It's a very emotional thing for people because they've been there a year, 2, 3, 4 years. And many people that are in assisted living and nursing homes, their family may be living elsewhere, so they visit periodically. So the people that are there taking care of them every day, those are their care angels.
Let me ask you this, Phil. And disclose we have a relationship with Bartley as well that is expanding as you become a supporter of public broadcasting. I'm curious about this. Health insurance and elder care. Talk about it from a public policy point of view.
From a public policy point of view, it's one of the problems with health care is insurance. When you think about it, there's a lot of government dollars that go into, especially into senior care, whether it's Medicare or Medicaid. And when you're dealing with insurance companies, I'm not a big fan of insurance companies, I'll tell you that right now, because they drain off dollars, very important dollars, because they have to make a profit. And I think one of the things missing in the healthcare debate right now is the question of what role should insurance companies play? Pay was a Freudian slip of some sort. But when you look at it, insurance companies, most often, they're very difficult to deal with, especially for the insured. Getting right authorizations, getting the right approvals can become a morass for people to try to deal with.
Do you help? Let me ask you this. To what degree does your organization help patients and their families navigate?
It is a big part of what we do. They navigate both. We have to help them navigate the insurance process. We also have to help them navigate Medicaid approval process.
Is that particularly challenging?
It's particularly challenging, especially in New Jersey, where...
what is it about New Jersey?
Because
Another thing about New Jersey?
Because there's 20... The way they do it in New Jersey, there's not a central part for approval. Each county has a board that approves it. There's 21...
For Medicaid?
For Medicaid. There's 21 different places you can go. So, for instance, if you happen to move right before or during a process, you have to go through a process of which county is going to handle it.
And you have people, sorry for interrupting, you have people from a lot of counties.
We have people from a lot of counties, and what happens is some counties, in fact, there's been some counties where people have waited almost a year for Medicaid approval, which is, a very grating thing. And then the other part of the process is there's not a lot of explanation that goes into it. So people get lost, and sometimes what we see is people come to us and say, what do we do? We'll explain it to them, and you can see the relief on their face saying, it seems like it's daunting, but you're going to help me, and that's going to be a good thing.
The other thing I want to ask you is, go back to the Felician part. You serve on the board of the Institute for Gerontology at Felician University. Describe that institute.
Well, when we were working with Felician, in fact, and I go back, I was brought in to meet people at Felician. Years ago, I was in an elementary school taught by Felician nuns, so it was kind of interesting. So I went back and...
For me, it was a Christian Brothers for me, but go ahead.
Yeah, okay. And so I learned very early, don't say no to nuns. So what happened there is I got a little more involved, and as I got involved with the nursing program and on their advisory boards, we looked at what the needs were. And one of the things that we looked at is that there's no organizations really that study what happens. What happens is a practical matter. There's a lot of think tanks that go into that, but there's no practical solutions.
Is that what the Institute's all about?
It's about practical solutions to problems. Study those problems, look at what they are, create situations where you can look at policy alternatives, suggest policy alternatives to deal with the day-to-day problems that people have.
In a few seconds we have left, we need to be more honest and candid about getting older, do we not?
We do.
Even though we don't want to talk about it, right, Phil?
Well, I'm laughing because I think people say, "What age do you think you are?" And you always think you're younger. And I'm in my 60s now. So from my perspective, it is. We have a culture, especially us baby boomers, have a culture of running away from age. But you have to embrace it, and it becomes a situation where you're going to need some help.
Yeah. We'll talk off the air. You give me some advice.
Okay.
Thank you, Phil. We appreciate it. Stay right there, buddy.
Good seeing you.
Catch you next time.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Felician University, Horizon Blue Cross Blue Shield of New Jersey, the law firm of Gibbons PC, New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor, the North Ward Center, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.